Let's go to KwaZulu-Natal now, where that province is expecting a high volume of people visiting the province during the December holidays. Now, the province has already raised concerns about the number of new COVID-19 cases. eThekwini Metro, for example, remains one of the areas with reported increases in daily COVID cases. So far, the area has contributed to almost half of the cases that province has recorded. And joining us now to tell us how the provincial government is planning to deal with the possible resurgence of COVID-19 is Sihle Zikalala, the Premier of KwaZulu-Natal. He joins us now from eThekwini. Premier, a very good morning to you and a warm welcome to Newsfeed. The number of active cases as we speak, how many would you say there are in your province?
Well, the numbers are worrying because they keep increasing. You will find that in a week, we will have something like 800, and then it has now moved to 1,600, which is worrying us. And that's why we are saying, let us be cautioned, let's follow all precautionary measures that have been put in place.
Yeah.
We are not at a situation where we should be frightened, but the situation is concerning, and that's why we are issuing an alert to all our people to be very careful and follow all protocols that have been issued. We are still under Regulation 1, lockdown Regulation 1, and we will need to follow all processes.
Premier, you spoke about the resurgence plan that is in place should your province see numbers that are alarmingly increasing. My question to you is, what are you going to do, or talk to us about that plan in relation to the visitors that your province is going to receive this coming festive season? KZN is known, in particular eThekwini, as the country's playground.
The first thing is that when people come to eThekwini, both in terms of the airlines, when they land or when they enter, there will be educational programs that will be in place to conscientize them to follow procedures. But at the same time, we will be checking whether they are indeed following what is expected. One, wearing of masks, sanitizing, and being restrictive of being all over. But on top of that, once they enter into hotels, we are going to ensure that procedures and the protocols are followed accordingly. In beaches, while we would not restrict people, but we would want to see people doing more in terms of sanitizing, washing of hands, and keeping our places healthy. But more than that, we are also continuing to reserve more beds should the situation demand that we get into a point where we accommodate those who will be infected.
Let's use a living example, Premier. Let's use one example that I think everybody will possibly understand. You're going to have people visiting the beach. As I talk to you, there were visuals playing on the screen of bathers. Lots of people will flock to one area, and lifeguards will probably encourage them to sort of stay within the perimeters. How do you monitor how many people go onto the shoreline and whilst maintaining social distancing at the same time?
Well, it might not be possible to restrict people when they go to the beaches, and you will know the situation. We also understand that people have suffocated during the lockdown. They would want to go out, but before people comes in, we will have to check temperature and do those measures that are in place, especially when they get into hotels, which are controlled, because it is unfortunately a reality that beaches are not that much controlled in terms of entry. And therefore, taking things like your temperature might not be possible, and conducting strict screening process might not be possible, but we will still want to see people following and understanding that we are still under the lockdown and therefore we must follow the processes.
The relaxations, Premier, all the way down to level 1, which is where we are, at some point you came out and said if the situation remains, or if the situation gets out of control where people are simply refusing to comply, we might see a situation where a lockdown, a much harder lockdown, is put in place. Is that what you plan for your province? Is that what is in the offing in KwaZulu-Natal?
We are identifying areas that are mostly affected and then zoom into those areas with educational programs and enforcement of the regulation.